Question 1. A nurse is caring for a newly admitted HIV-positive client who presents with a persistent cough. What is the most appropriate room assignment for this client? A. Assign the client to a semi-private room with another HIV-positive client. B. Assign the client to a negative pressure isolation room. C. Place the client in a room with a post-operative surgical patient. D. Assign the client to a pediatric observation ward. Answer. A. Assign the client to a semi-private room with another HIV-positive client. Question 2. A nurse is teaching a newly diagnosed HIV client about self-care. Which instruction is most critical to include? A. Encourage sharing personal hygiene tools with family. B. Discontinue medications if experiencing mild nausea. C. Report persistent diarrhea to the healthcare provider. D. Engage in vigorous exercise to boost immunity. Answer. C. Report persistent diarrhea to the healthcare provider. Question 3. A client with HIV is experiencing significant weight loss and wasting. Which interdisciplinary consult is most appropriate? A. Speech therapist. B. Physical therapist. C. Registered dietitian. D. Occupational therapist. Answer. C. Registered dietitian. Question 4. A nurse is delegating care for a client with advanced AIDS to a UAP. Which task is most appropriate to delegate? A. Administering antiretroviral medications. B. Assessing skin for Kaposi's sarcoma lesions. C. Assisting with a bed bath and linen change. D. Teaching about hand hygiene. Answer. C. Assisting with a bed bath and linen change. Question 5. The nurse is reviewing lab results for a client with HIV. Which lab value should be reported immediately to the provider? A. CD4 count of 550 cells/mm superscript 3. B. Platelet count of 180,000/mm superscript 3. C. Viral load of 1,000 copies/ml. D. CD4 count of 180 cells/mm superscript 3. Answer. D. CD4 count of 180 cells/mm superscript 3. Question 6. A nurse cares for an HIV-positive client with active tuberculosis. What is the priority infection control intervention? A. Place the client in droplet precautions. B. Use standard precautions only. C. Initiate airborne precautions. D. Use surgical mask for all staff. Answer. C. Initiate airborne precautions. Question 7. A nurse is planning care for an HIV client with oral candidiasis. What is the priority nursing diagnosis? A. Risk for skin breakdown. B. Imbalanced nutrition, less than body requirements. C. Ineffective airway clearance. D. Risk for falls. Answer. B. Imbalanced nutrition, less than body requirements. Question 8. A nurse is providing discharge teaching to a client with HIV. Which statement by the client indicates understanding? A. I will stop my medications if I feel better. B. I will avoid cleaning my cat's litter box. C. I can receive live vaccines now. D. I will donate blood regularly to help others. Answer. B. I will avoid cleaning my cat's litter box. Question 9. Which client should the HIV nurse assess first after receiving the morning report? A. Client with HIV complaining of mild nausea. B. Client with HIV who missed one antiretroviral dose. C. Client with HIV reporting new onset confusion. D. Client with HIV requesting a snack. Answer. C. Client with HIV reporting new onset confusion. Question 10. A nurse cares for a client with HIV who is prescribed multiple medications. What action is most important to avoid medication resistance? A. Encourage occasional breaks from therapy. B. Ensure strict adherence to medication timing. C. Take medications with grapefruit juice. D. Use antacids with each medication dose. Answer: B. Ensure strict adherence to medication timing. Question 11. Which task is appropriate for the nurse to delegate to a UAP caring for an HIV-positive client? A. Assessing oral mucosa for candidiasis. B. Educating on antiretroviral therapy side effects. C. Collecting a stool specimen. D. Administering a flu vaccine. Answer: C. Collecting a stool specimen. Question 12. A client with HIV is started on a new antiretroviral regimen. Which side effect should the nurse report to the provider immediately? A. Mild headache. B. Jaundice. C. Nausea. D. Fatigue. Answer: B. Jaundice. Question 13. A client with HIV and CD4 count of 150 cells/mm superscript 3 is at risk for which opportunistic infection? A. Otitis media. B. Pneumocystis pneumonia. C. Cellulitis. D. Streptococcal pharyngitis. Answer: B. Pneumocystis pneumonia. Question 14. A nurse is caring for a client with HIV who is experiencing difficulty swallowing. What is the priority action? A. Offer thickened liquids. B. Administer antacids. C. Assess for oral lesions. D. Encourage carbonated drinks. Answer: C. Assess for oral lesions. Question 15. Which instruction is appropriate when teaching a newly diagnosed HIV client about safe practices? A. Share razors with household members. B. Use condoms during all sexual activity. C. Discontinue medications when symptoms improve. D. Attend crowded public events freely. Answer: B. Use condoms during all sexual activity. Question 16. The nurse receives 4 HIV-positive clients. Which one should be assessed first? A. Client with a fever of 100.4 degrees Fahrenheit. B. Client with night sweats and weight loss. C. Client with sudden shortness of breath. D. Client reporting fatigue. Answer: C. Client with sudden shortness of breath. Question 17. A nurse is educating a group about HIV prevention. Which statement should be included? A. You can acquire HIV from mosquito bites. B. HIV is transmitted through saliva. C. Consistent condom use reduces HIV transmission. D. Vaccination prevents HIV. Answer: C. Consistent condom use reduces HIV transmission. Question 18. Which HIV-positive client can be safely assigned to a pregnant nurse? A. Client with cytomegalovirus (CMV) infection. B. Client with active toxoplasmosis. C. Client with Kaposi sarcoma. D. Client with tuberculosis. Answer: C. Client with Kaposi sarcoma. Question 19. A nurse is caring for a client with HIV and notices purplish skin lesions. What is the most likely condition? A. Herpes simplex virus. B. Toxoplasmosis. C. Kaposi sarcoma. D. Cytomegalovirus. Answer: C. Kaposi sarcoma. Question 20. A nurse teaches an HIV-positive client about infection control at home. Which statement indicates the need for further teaching? A. I will wash fruits before eating. B. I will wear gloves when gardening. C. I will eat rare steak to maintain protein. D. I will avoid contact with people who are sick. Answer: C. I will eat rare steak to maintain protein. Question 21. A nurse is planning a meal for a client with HIV experiencing oral thrush. Which food is most appropriate? A. Dry toast and scrambled eggs. B. Mashed potatoes and pudding. C. Spicy chili and corn chips. D. Crackers and peanut butter. Answer: B. Mashed potatoes and pudding. Question 22. A client with HIV reports night sweats and fever. Which diagnostic test should the nurse anticipate? A. Rapid strep test. B. Chest X-ray. C. EKG. D. Colonoscopy. Answer: B. Chest X-ray. Question 23. A nurse is caring for an HIV-positive client with a low white blood cell count. Which action is a priority? A. Monitor for bleeding. B. Restrict protein intake. C. Limit visitors with infections. D. Encourage high-residue diet. Answer: C. Limit visitors with infections. Question 24. A client with HIV is prescribed nevirapine. Which lab should be monitored closely? A. Hemoglobin. B. Liver enzymes. C. Potassium. D. Magnesium. Answer: B. Liver enzymes. Question 25. Which client with HIV requires immediate intervention? A. Client with nausea after meals. B. Client with 2 episodes of loose stool. C. Client reporting blurred vision and headache. D. Client complaining of dry mouth. Answer: C. Client reporting blurred vision and headache. Question 26. A client with HIV is anxious about disclosing their status. What is the nurse's best response? A. You should inform your employer right away. B. Let's talk about how disclosure can be done safely. C. It's better to keep your condition private. D. Just tell people you're taking vitamin therapy. Answer: B. Let's talk about how disclosure can be done safely. Question 27. A nurse is educating a client with HIV about infection prevention. Which action by the client requires correction? A. Washing hands before meals. B. Wearing gloves when cleaning the litter box. C. Eating raw oysters at a seafood restaurant. D. Using a soft bristled toothbrush. Answer: C. Eating raw oysters at a seafood restaurant. Question 28. A nurse is caring for a client newly diagnosed with HIV. Which psychosocial nursing diagnosis is most appropriate? A. Risk for aspiration. B. Impaired verbal communication. C. Anxiety related to disease prognosis. D. Disturbed sensory perception. Answer: C. Anxiety related to disease prognosis. Question 29. Which PPE is necessary when giving a bed bath to a client with HIV? A. Gown only. B. Gloves only. C. Mask and gloves. D. No PPE is needed. Answer: B. Gloves only. Question 30. A nurse is reviewing prescriptions for a client with HIV and renal impairment. Which order should be clarified? A. Zidovudine 300 mg PO bid. B. Acyclovir 800 mg 5 times daily. C. Furosemide 20 mg 4. D. Multivitamin daily. Answer: B. Acyclovir 800 mg 5 times daily. Question 31. A pregnant client tests positive for HIV. Which intervention helps reduce vertical transmission risk? A. Schedule vaginal delivery. B. Begin antiretroviral therapy. C. Discontinue therapy in the 3rd trimester. D. Encourage breastfeeding to build immunity. Answer: B. Begin antiretroviral therapy. Question 32. A nurse is delegating care for an HIV-positive client with fatigue. Which task can the UAP perform? A. Evaluate effectiveness of antiretroviral therapy. B. Assist with ambulating to the bathroom. C. Instruct on medication adherence. D. Assess skin for pressure injuries. Answer: B. Assist with ambulating to the bathroom. Question 33. A client with HIV has a CD4 count of 45 cells/mm superscript 3. What is the priority nursing action? A. Administer routine vaccinations. B. Limit oral fluid intake. C. Implement neutropenic precautions. D. Discontinue all medications. Answer. C. Implement neutropenic precautions. Question 34. A client with HIV is prescribed efavirenz. Which instruction should the nurse include? A. Take medication in the morning with food. B. Take medication at bedtime to reduce CNS effects. C. Crush and mix with juice. D. Double dose if one dose is missed. Answer. B. Take medication at bedtime to reduce CNS effects. Question 35. A client asks how HIV is different from AIDS. What is the best response by the nurse? A. HIV is a virus. AIDS is a bacterial complication. B. AIDS is the early stage. HIV is the advanced condition. C. AIDS occurs when HIV has significantly weakened your immune system. D. HIV always progresses to AIDS within 6 months. Answer. C. AIDS occurs when HIV has significantly weakened your immune system. Question 36. A client with HIV is prescribed prophylactic antibiotics. What is the most likely reason? A. To prevent influenza. B. To prevent pneumocystis pneumonia. C. To treat latent TB. D. To manage cytomegalovirus. Answer. B. To prevent pneumocystis pneumonia. Question 37. The nurse prepares to discharge a client with HIV who lives with roommates. Which statement requires follow-up? A. I will keep my toothbrush separate. B. I can share my razors if I disinfect them. C. I won't share personal grooming items. D. I will clean spills with a bleach solution. Answer. B. I can share my razors if I disinfect them. Question 38. A nurse is caring for a child with HIV. Which vaccine should be questioned? A. MMR. B. Hepatitis B, C. IPV. D. Influenza inactivated. Answer. A. MMR. Question 39. A nurse receives 4 calls. Which HIV-positive client should the nurse see first? A. Client with white patches on tongue. B. Client with nausea after meds. C. Client with fever and productive cough. D. Client with mild weight loss. Answer. C. Client with fever and productive cough. Question 40. A nurse is caring for a client with HIV and oral lesions. Which meal selection is best to recommend? A. Toast with jam and orange juice. B. Warm soup with soft bread and ice cream. C. Chips with salsa and soda. D. Crackers and pineapple chunks. Answer. B. Warm soup with soft bread and ice cream. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.